Hi guys, how you guys doing? So this video, I'm going to address a bunch of questions that I get in my email because a lot of people send me email because they want to interview me. And sometimes I open up this email and it's like 20 million questions. Like, I kid you not, like 50 different questions. And I look at it and I'm tired already just from looking at the questions. I'm not even gonna lie. So most of them I tell them, if you want to do like a face-to-face interview, like a Zoom call, I'll do that, or like a voice note on Instagram, I'll do that. But for me to sit down and type out those answers to those questions, honestly, I don't have the luxury of the time to do that. I'm sorry, I really don't. So I screenshotted a lot of the questions that I got on the phone, and I'm going to try to answer them. So if you have an assignment in school to interview an OT, you can just watch this video and it will be able to answer all the questions, or most of the questions that you have. If I don't answer any question that you may have, you can just definitely leave it down below and I'll go ahead and answer that for you guys, okay? I've made a lot and tons of video, and some of the videos answer these questions that you guys are asking me. If you have the patience enough to watch my videos, you will probably get the answers that you're looking for by watching my videos, and that's the best way to do it. So question number one, what are the responsibilities and duties of your position? I also type the questions here so you guys can see it. Responsibilities and duties of my position: to evaluate my patients, to give them treatments. I work in a skilled nursing facility, so I work with the geriatric population. So whatever diagnosis that the patient has and whatever symptoms that they're experiencing, my job is to assess them, come up with goals for them, and also come up with interventions to help them get better, okay? And also be able to engage in whatever activity that is meaningful to that particular patient. What do you do in a typical day? I have a video that talks about what my typical day is like in a skilled nursing facility, so I'm going to link that video down below. What does your schedule, how does your schedule vary from day to day, month to month, or even week to week? My schedule varies based on, my schedule basically changes every day. It really depends on how many patients that I'm gonna see. It depends on if I've gotten a new patient that came in that I need to assess or evaluate. It depends if a patient is available or not. So my schedule changes based on that. So I don't have like a set hours of schedule, but I am a full-time worker, so I'm expected to work at least 30 hours a week. How would you describe the demands of your position? For example, time involved per week, job pressures, complexity, and people problems. How would you describe the demands? Demands of my position, I would say that my job requires a lot out of me. I need to be present physically with my patients, emotionally with them. So that in itself is demanding on its own. Dealing with many people with different personalities and different illnesses also comes with its own demands as well. Dealing with other disciplines like nurses, GNAs, and trying to collaborate and work together can also be demanding. Working for different rehab companies, depending on the company, can also bring its own demands and difficulties as well. Working with different insurance companies can also be difficult. Family members can be difficult and can be demanding. So all of those different things can cause a job to be a little bit more demanding. Qualification: how much schooling and what kind of degree is needed to be an OT? I have my I got my college degree, my undergrad degree, 4 years, and then I did graduate school for 3 years. Okay. So you need your master's or your doctorate to be an OT. You can also be an occupational therapy assistant if that's what you choose to do. Are there any courses you recommend I take in my undergrad in order to prepare myself well for grad school? A minor I should declare? Any interventions, jobs, or job shadowing opportunities I should be aware of? Courses, I would say, as far as courses, like take your functional anatomy courses, like your prerequisites. Make sure that you take those prereqs classes and make sure that you pass those classes, because if you do better in those classes, then you have a better chance to get into a T school. As far as minor, I have a I had a degree in psychology and a minor in gerontology. Your degree really doesn't matter in OT. You can be your undergrad degree can be in any kind of degree whatsoever that you choose, and you'll be fine. However, if you want a recommended degree, I have a video on that, and I also have a post about it on Instagram that you can check out for more information about that. Shadowing opportunities. I shadowed in different like OT settings. If you have more questions, I have a post on my Instagram about this particular question. What kind of skills does one need to possess in order to succeed as an OT? Once again, I have a video of this, and I'm going to link that down below, because I go into in-depth explanation of the skills that you need. But you definitely need to be a people person, know how to connect with people and work with people. That's like the number one skill, but there's a whole list and this video on that particular question. What other advice would you give someone planning to enter this type of work? I'll definitely tell you the same thing with the skills. Like, you need to be, you need to prep yourself to be ready to work with people of all ages, all sizes, all color, all cultures. You need to be ready for that. So you just need to learn how to work with multiple people. Okay. Is the job outlook in this field expected to grow? Would there be good opportunities for someone like me? I'm not sure who someone like you are. Like, you mean like someone who's getting into OT school, maybe? Yes, OT is not going anywhere. Okay. If anything, I feel like we're just getting started, and we just started branching on to other sectors of healthcare. So if anything, I think the job outlook is great. Okay. So don't be scared or fearful about going into OT. I don't think that you will regret it. Do you have an estimate of starting salary for an entry level position in this field? Once again, I made a whole video about salary. However, it really depends on the setting that you're going to be working in, and also the state where you work. Each state have a different rate, and the setting that you work also have their own rate. However, as a new OT grad, I honestly feel like companies need to pay new grads a lot more than they have been paying them. The lowest that I've heard is like $38 an hour, which I feel like is low. I feel like companies need to do a lot better with that rate. Okay. What kinds of changes are taking place in this? What kind of changes? Definitely with COVID, there's been a lot of changes that's taken into place, especially with telehealth and all of that. That has been different. That's not something that we have dealt with before. So, a lot of things are changing in those ways, where a lot of people want to be home versus being in a nursing home because of the obvious reason of COVID. And also, a lot of older people also want to age in place and be at home instead of living in a community center. I mean, living in retirement homes or being in a nursing home. So those are the type of changes. There's also some changes as far as like payment models and things like that has taken into place already. And so, yeah, there's always some kind of ongoing changes that's happening. What are other occupations that are closely associated and closely related with OT? Definitely physical therapists, and I feel like I relate OT a lot more to PT than speech, but I definitely can relate to either or. And also like rehab tech jobs, or like exercise science. That's the word. That's the other one too. What do you like best about your job? I love everything about my job. I love the whole concept of rehab and rehabilitation. Prehabilitation is also very interesting to me. So I love everything about it. I love the fact that I'm able to help people regain strength and regain the ability to do the things that they want to be able to do, to be able to gain new skills or regain lost skills. So those are all the things that I love about my job. What causes you the most frustration about your job? Definitely dealing with different insurance companies can be very frustrating sometimes. I will say that sometimes also dealing with different like personalities can be difficult, different behaviors. But it's not frustrating. It's just something that you kind of work around, and you learn. as you go. But definitely insurance can be frustrating. And also dealing with different rehab companies that don't really care about us, the therapists, and the fact that they're paying us next to nothing compared to the job that we're doing can sometimes be um, a bit frustrating. Being valued more for your productivity than the actual outcome of your patients can be frustrating sometimes. So, yeah. What is your current occupation and how long have you been in that role? I work in a skilled nursing facility working with geriatric population. I've been working there for over 3 years, almost 4. Um, what alternatives did you consider before deciding on this career? I wanted to be a psychiatrist. That was something that I wanted to get into before OT school. Educational background, I already mentioned that. What were the primary factors that led you to choose your current occupation? I have a whole video explaining why I chose occupational therapy. And I've also made a post on it on Instagram. So check that out. However, I chose OT because I feel like OT chose me. In a lot of ways, like I already mentioned, I love the concept of rehab and rehabilitation. What settings can OTs work in? I have a whole video on this, so I'm not going to repeat that. I'm going to link it down below. What kind of population can OT work with from birth to death? Okay, I should say from birth to hospice. What are there other types of OTs other than the ones who work in clinical settings? Absolutely. You don't have to work in a clinical setting as an OT. Okay, clinical setting can be a little like clinical setting. You can work in schools, you can work in a community. So, yeah. What is the range of earning potential for an OT from entry level at the end of career? At the end of their career, like earning potential? God, like anywhere to 60 an hour to $100 an hour, depending on what you're doing. If you're working for yourself, the company that you work with, what you're specializing in, and all of that stuff. Would you consider the job stressful or emotional taxing? What do you do to take care of yourself in your time off? I feel like I don't even have a time off because when I am off work, I am working on my YouTube, I'm working on my Instagram, I'm working on collaborations, emails, and things like that. So I'm barely off. However, when I do force myself to take time for myself because I know how important self-care is. So when I do my self-care, yes, my job is very stressful emotionally. Um, so taking care of yourself is non-negotiable. You have to take care of yourself. You have to feed your brain, your soul, your emotions outside of work. Is definitely important. What do? I usually do the things that I love. I love to dance. I love to listen to music. I love to cook. I love to just be there, have a good time, watch a good movie. The little things make me happy. So I don't need to do anything grand for me to be happy. So anything simple, music, a good book, a good movie is something that I do. What diagnosis do you typically see? I also have a post about this on my Instagram. However, I see a lot of stroke patients, TBI, spinal cord injuries, MS, a lot of any kind of neuro condition that you can think of, heart diseases. Did I say cancer? Cancer, fractures, um, alcohol related illnesses, diabetes, anything that you can possibly think of, I've seen. What type of treatment activities do you do? My treatment activities really depend on the patient, what they need. It also depends on their goals and what we're working on. Usually I do a lot of self-care training to allow the patient to be able to do their own self-care, upper body, lower body, taking a shower, using the toilet by themselves. Things like that is mostly what I do. Is it sustainable to work at a SNF for long at a SNF long term? Yes. I mean, I've been doing it for almost 4 years. Has it been 4 years yet? Almost 4 years. And so, yeah, I definitely think that it's sustainable. You have to take care of yourself to avoid burnout. You have to work with a good company to avoid burnout. Your team also makes things a lot better, which means your therapy team, the staff that you work for, the nursing staff, all of those people definitely make a world of a difference. So, yeah. How likely or common is burnout for OT at a SNF? I know a lot of people say that they have gotten burnout from SNF pretty fast, but it's not just SNF. Like any kind of setting you can get burned out from if you don't take care of yourself. So it's definitely common. How do you differentiate between OT services between SNF and inpatient? SNF is more subacute and inpatient is acute. So acute care is more, inpatient is acute care. You spend a lot of time with the patient. So you can see a patient for like 60 to 90 minutes a day, but usually the stay is on a shorter period of time. Whereas in SNF, I see patients like even 15 minutes, 30 minutes, all the way up to an hour. But I also have my patients for a longer period of time. I can have a patient for like 3 months or more, depending on what they need. Okay. However, inpatient usually need more intensive therapy, and that's why the treatment minutes is a lot more as well. What are the best ways to try and do IADL tasks in SNS? You can do some cooking, you can do laundry, you can do cleaning tasks, making their beds, simulating like going shopping and picking up things. You can also, if you don't have the things with you, you can always be creative. You can always be creative and simulate any kind of ideal task that you want to do. I do it all the time. Are SNFs really all about time productivity? Or are they client-centered? I treat my patients client-centered first. Okay, as a clinician, you get to make your own rules ethically. I think my productivity, I don't even know my productivity standard because, like I said, I do what I feel like I'm supposed to do. If my productivity is low for whatever reason, I try not to stress myself at work too much. If I need to see my patient for 30 minutes and I went over 35, I'm going to bill for 35, and that's just what it's going to be. If I can do point of service documentation, I know that I need to be productive 84, I think it's 84, 85% for me. I do the best that I can every day. So I try not to think about it too much, but I also try to be as productive as possible, meaning that I'm not just going to be clocked in and sitting around doing nothing. Do you handle productivity standard? How do you handle productivity standard? I made a whole video about productivity, so I'm hearing some weird noise in my apartment. I don't know what the hell is going on, but um, I think it's from upstairs. There's some ghost in this house. No, I'm just kidding. No, I have also made a whole video talking about productivity standards, so I will link that down below for you guys as well. So because that goes into depth of productivity. I feel like a lot of these questions I've already answered, honestly. How do you better document faster? I made a whole video about documentation. Point of service documentation is the best way to document. Document while you're still with your patient before you leave them. People tend to talk about SNF in a negative light. Can you touch upon this? I don't talk about SNF in a negative light. I think SNF is a good setting as long as you know what you're doing, you are ethical about what you're doing, and you are putting yourself and your patients first. There's nothing bad about working at SNF, and I don't know why it has such a bad rap. But there's a lot of pros and a lot of cons in whatever setting that you work in. So I personally don't see SNF in a negative light. But if you do, tell me why down below and maybe we can chat. I think most of the time is because a lot of these SNF settings are like for profit, and so most of the time it's like they put their money before anything else, and that can be upsetting. And also productivity standards and different things like dealing with insurance and things like that, but that can be anywhere. I know it depends, but what is the minimum pay to accept in SNF? The minimum pay, I would say, don't accept anything less than $38 an hour, especially as a new grad. If you are not a new grad, then you definitely should be asking for more, at least 40 and up an hour. On your toughest day at work, what keeps you motivated? When I have a tough day, which I do, I think what keeps me motivated when I'm having a tough day is definitely my patients. I always think about why I started OT to begin with and why I went into healthcare to begin with, and OT specifically. So I think about those things. I think about the fact that it's not about me. It's about my patient. They are going through a tough time dealing with all of these different diagnoses. And so I think about that and I kind of take myself out of the equation. Like, it's not about me and my feelings. It's about me providing the best care as possible to my patient, no matter how tough it is. I need to get it together as a clinician, as a professional, and do my job the best way that I can possibly do it. What is the hardest thing about transition from OT student to actual practitioner? I think the hardest part will probably be the fact that now you are in charge, okay? You call the shots, you make the decisions as much as possible. And so that is the hardest part, the fact that you have to now be responsible for everything. Do you ever make splints in this setting? Orthotics? No, I don't make them. I buy them, but I do modify my splints to fit my patients better. However, if we did need something to be customized, we do have a contact person that can come in and make customized things if needed. I heard that in the SNF you do more diagnosing than treatment. I think that's what this question is saying. More diagnosing than treatment. I'm not sure what this question is asking. Do I do more diagnosing than treatment? I don't do diagnosing. I do a lot of treatment. So I don't know where that's coming from. I don't know. What are your values in occupational therapy? I would say like the AOTO values is definitely equality, freedom, justice, dignity, truth, and prudence. Altruism. I can never say the right. That's also another value in OT. How does culture influence occupation? Oh my God, of course. Everything that you do is influenced by culture. So culture definitely influences how you live your life every day. So it's definitely essential, very important. How do you reflect on practice? Do you reflect on practice? And is this mandatory? If so, which reflection models are you most likely to use? I've never heard of reflection models. Reflective models? What is that? I don't know. Send me a DM down below. Send me a comment down below if you're watching this and you send me this question so I know what it is and maybe I can provide a better answer because I have no idea what you're talking about. What code of ethics do you follow? List them. Veracity, fidelity, autonomy, justice, beneficence or non-maleficence, beneficence and non-maleficence. I think that's how you say that word. I'm going to list it here or here for you guys so you know what I'm talking about. Basically, be truthful, be loyal to your patient, be respectful to other people, show care for your patients, bring no harm to your patients, and yeah, that's justice. Justice is definitely, advocating for your patients and doing what's fair and what's right. I can list those down below for you guys as well. Who is your governing body? AOTA. Okay. American Occupational Therapy Association. That's my governing body. If you needed to contact me because you have additional questions, you can definitely do that. But make sure that you have watched this video and also the numerous amount of videos that I have made, because a lot of them do answer the questions that you are looking for. And also follow me on lovely_OT, because a lot of the posts that I make on my Instagram also addresses a lot of these questions as well. And then once you do that, you can send it to me and I can review it, edit it, and give you the go ahead. Sounds good? Good? Okay, good. Now, make sure that you subscribe, like, and comment, and I'll see you in the next video. Thank you guys so very much, and bye.